Hey there, Dr. Mamina here. I wanted to bring up a subject that many of my patients are always curious about, and that is hair growth supplements. So do the popular brands that we see all over social media really work, or are they too good to be true? If you don't know me, I'm Dr. Mamina a triple board certified dermatologist, internist, and dermatopathologist with a special interest in integrative medicine. I've been treating patients in dermatology for over 15 years and have been in private practice for the last 10 years. If you struggle with hair loss or just want healthier, longer hair, I'm sure you've clicked on an ad maybe or two while scrolling. But are hair supplements the answer? Well, before you click and buy, it's important to understand the basics of hair growth and why we get hair loss in the first place. So here's what you need to know. Hair growth occurs in 4 stages. There's anagen, catagen, telogen, and exogen. The anagen phase is the stage of active hair growth. So this is where the hair follicle is producing new hair cells, which results in visible hair growth. The anagen phase can last from 2 to 7 years, depending on like your genetics, your age, where the hair is growing. So for example, scalp hair obviously has a longer anagen phase than other body parts. So during this phase, the hair grows about ½ an inch per month, about a centimeter give or take. And about 85 to 90% of the hairs are in anagen phase at any given time. If you see someone's hair growing down to like their butt, that means that they have a really long anagen phase. Not everyone can grow hair that long. The next phase is the catagen phase or transitional phase. This phase is between the active hair growth phase and the resting phase. During this phase, the hair follicle shrinks and it detaches from the dermal papilla, which is the structure at the base of the hair follicle that supplies nutrients to growing hair. Only 1 to 3% of hairs are in the catagen phase for a short period. It's typically like 2 to 3 weeks. The hairs then transition to telogen phase. So the telogen phase is the resting phase of the hair growth cycle. This is where the hair follicle remains dormant and no longer produces new hair cells. At any point in time, about 10 to 15% of scalp hairs are in the telogen phase. And then we see a higher percentage of hairs in the telogen phase when people are experiencing hair loss from telogen effluvium, as well as like androgenetic alopecia. During this phase, which lasts around 3 to 4 months, the hair is fully formed but not actively growing. And then after the telogen phase, the hair enters the exogen phase, which is where old hair sheds to allow for new growth. Now that you have a better understanding of the process of hair growth, let's talk about the different factors that can affect hair growth and hair loss. So first, genetics does play a huge role. It's not the only thing, obviously, but it does play a role, especially with androgenetic alopecia. Androgenetic alopecia or androgenic alopecia is also known as male or female pattern baldness. This is an inherited condition. Of course, it's aggravated by external factors, and it's the most common cause of hair loss. And like I said, it's not just your genetics, it's things like your diet that can have a significant impact. Low protein, low iron, low vitamin D, these can all contribute to hair loss. So if you're already genetically predisposed, you are more likely to manifest hair loss if you are low in certain vitamins or minerals. On the flip side, a balanced diet rich in these nutrients can help support healthy hair growth. Another factor that can contribute to hair loss is stress. A stressful event like an illness, a surgery, or losing a loved one, these can all trigger something called telogen effluvium, where you can get temporary shedding of your hair. It's called telogen effluvium because the shock from this stressful event or chronic stress can convert your hairs to the telogen phase, which lasts 3 to 4 months. Then once those 3 to 4 months pass, the hair then begins to go into the shedding phase where it sheds. Oftentimes, when a patient comes in with hair loss, I'll ask them about any kind of stressful events that have happened in their lives in the few months prior to them noticing hair loss. And for those who already have androgenetic alopecia, stress can make it worse. I can attest to that. I have a really strong family history of androgenetic alopecia. My dad was bald at 19. I experienced so much hair loss when I was in residency. It's not fun, and it was definitely stress-induced. And then with COVID, we've seen a lot of hair loss related to COVID too. People just getting really sick from COVID and then shedding all this hair a few months later. And unfortunately, the list of triggers doesn't end. Of course, there's things like hormonal imbalances that plays a big factor with hair health. So conditions like hypothyroidism, menopause, birth control, PCOS, aging, postpartum, like all these hormonal shifts make a huge impact on hair loss. Other underlying conditions that can affect hair loss include things like inflammatory scalp conditions like seborrheic dermatitis, otherwise known as dandruff, psoriasis, autoimmune conditions like alopecia areata or lupus. So addressing these underlying issues is important to manage hair loss effectively. And then there are also physical factors like traction, like pulling on the hair. So even like your hairstyle can cause hair loss. Tight braids, tight ponytails can cause traction alopecia as it pulls on your hair. I know that was a lot of information, but the truth is hair loss is complicated, which is why I always recommend seeing your dermatologist to diagnose the root cause of your issue rather than looking for a quick fix. When it comes to treatment, I take a multifaceted approach. I usually start with like a thorough medical and family history review. I do a physical exam, of course. I do a biopsy if needed. I also order lab work to check for any underlying deficiencies or hormonal imbalances. So depending on what I learn from all of these tests and findings, I may prescribe certain medications like finasteride or dutasteride for men or postmenopausal women, especially for androgenetic alopecia. I also will do like spironolactone at higher doses for premenopausal women, and then oral minoxidil I do often, especially if people are having active hair shedding. And then depending on what the blood work shows, I may also recommend certain supplements. So stick to the end to see what my favorite hair supplement is. There are many supplements out there that can support hair growth if they contain the right ingredients. These are a few of the ingredients that I look for and how they work. Starting with saw palmetto, which promotes growth by reducing something called DHT or dihydrotestosterone. This plays a big role in hair loss. So this hormone shrinks hair follicles and leads to progressive hair thinning. Another ingredient I also look out for, something called horsetail. The horsetail is a natural form of silica which can just promote hair strength. I am also a fan of hydrolyzed marine collagen peptides. So these peptides provide building blocks for strong hair and delivers moisture to the scalp. Then there's also vitamin B3 or niacinamide. Niacinamide has so many helpful uses for the skin. For the hair, it can actually increase circulation to the hair follicles, which can promote healthy hair growth and enhance like hair texture and hair health. Other key vitamins and minerals are things like vitamin A, vitamin C, D, and E. Vitamin A can regulate hair follicle stem cells. Vitamin C aids other amino acids and peptides when it comes to building stronger hair. Vitamin D has anti-inflammatory and immunomodulatory properties, and it also can regulate keratinocyte differentiation and proliferation, which can play a role at that hair follicle. Vitamin E can improve hair density by minimizing the effects of environmental stress. You know, it's an antioxidant. Zinc is also a pretty vital mineral for the structural integrity of our hair. It's a potent inhibitor of hair follicle regression and an accelerator for hair follicle recovery. Iron can boost circulation and help move more oxygen to the cells in your scalp. There's another ingredient I like, MSM, which stands for methyl sulfonylmethane. Sulfur is the main ingredient in MSM, and this is vital for generating hair, cartilage, and collagen in the skin. And I think more and more data is supporting that. Another interesting ingredient are apple polyphenols. So this is an antioxidant-rich extract from apple skin that promotes hair growth by supporting cellular health. So we talked about the herb saw palmetto. There's other herbs like ashwagandha, shatavari. These are considered adaptogens. So adaptogens help your body adapt to stress more easily. They can balance stress hormones, support healthy hair growth cycle, because we do know that stress can get in the way of that. And then there's curcumin, which is an ingredient that's found in turmeric, supercharged antioxidant that has a variety of different anti-inflammatory properties that also has been shown to help with hair thinning and hair loss. And then, okay, of course, how can I forget vitamin B7 or biotin? Okay, so while this is one of the most commonly used ingredients for hair growth, biotin's effectiveness is actually still debated. Everyone thinks that biotin is where it's at for hair growth, but the studies are actually kind of small. I would say that biotin's mostly popular because of the anecdotal evidence of so many people using it. I think it's great for nail health, and it can help with those who've acquired or inherited forms of biotin deficiency, which is really rare. And some people are like, well, what's the harm? It's a B vitamin. What's the harm in taking it? So there are actually drawbacks, especially if you take higher doses. These can actually interfere with critical lab tests and can cause even acne breakouts too. But when it comes to lab tests, it's been shown to alter the lab test results for cardiac markers, which is what we test during a heart attack. It's also been shown to alter thyroid hormone lab tests. It can show a falsely elevated T4 and T3 and a falsely low TSH. Also important for people who deal with hypothyroidism. Because of this, I don't recommend taking more than 5,000 micrograms of biotin a day. Okay, so now that you know what causes hair loss and how certain ingredients can help, let's talk about a few of the popular hair growth supplements out there. So let's start with one that you've most likely heard of, and that is Nutrafol. Nutrafol offers different supplement blends to support some of the various causes of hair loss. So they have a blend for premenopausal women, postmenopausal women, postpartum women. They have a blend for men. Depending on the blend, Nutrafol does contain many of the ingredients that we covered, including hydrolyzed marine collagen. One of them has the apple procyanidins. as well as ashwagandha, shatavari, saw palmetto, curcumin, and a whole host of different vitamins and minerals, including A, C, D, and E, B vitamins, including biotin, iodine, selenium, and zinc. It's got a lot. I mean, you have to take 4 pills a day. I think the key ingredient Nutrafol is hydrolyzed marine collagen. Studies have shown that marine collagen supplements can increase the growth of terminal and vellus hairs, so thick hairs and the baby hairs. It can also increase the diameter of terminal and vellus hairs, as well as decrease hair loss. Viviscal is another popular hair growth supplement that also contains hydrolyzed marine collagen, and it's often compared to Nutrafol. So while Viviscal does contain this lovely amino acid blend, it does have fewer ingredients than Nutrafol, which can make it more suitable for somebody who's already taking a bunch of other vitamins and minerals or adaptogens, and they may not need all of that may come with Nutrafol. For people who want to play it safe, Viviscal may be just a better option for them. Nutrafol and Viviscal aren't the only hair growth supplements getting attention though. Mary Ruth Organics went completely viral for its liquid multivitamin and its ability to help with hair regrowth. This brand has since released a liquid multivitamin enhanced with certain hair growth ingredients like MSM, a variety of amino acids, and magnesium. Another option that has gained a lot of social media attention is a supplement called ARMRA. ARMRA's key ingredient is something that we haven't covered yet. It's called colostrum, which is it's the first milk that comes out of a cow before it turns into regular milk. Actually, any mammal gets colostrum. Humans make colostrum, but in ARMRA they use cow colostrum. Colostrum bioactives have been shown to reactivate hair follicle stem cells and support the hair microbiome. So all these things can work to combat hair loss and help repair like damage to the hair follicle. And then Vegamour has things like biotin. It has a variety of other B vitamins, vitamin A, C. It also has cannabinoid, which has some anti-inflammatory properties to help with the scalp. The other one I was going to mention was AG1 or Athletic Greens. This is a pretty comprehensive blend of different multivitamins, minerals, adaptogens like ashwagandha. It has anti-inflammatory ingredients like turmeric and other things that can help kind of stimulate blood flow to the scalp like green tea extract. So it's not surprising that this beverage, it's like a supplement powder that you drink in a beverage, that can also help with hair growth. Andrew Huberman seems to promote it a lot. Okay, so the question is, do hair growth supplements really work? Well, based on the fact that I spent the last few minutes talking about the benefits of a variety of different ingredients from hair growth supplements, the answer would be yes. But yes, it also depends on the ingredient and your individual needs. And I talked about a lot of ingredients that have science backing their benefits, but like biotin, I do feel like we need bigger studies. A lot of these ingredients have like a bunch of small studies. So I think that we could do a little bit of a better job with the science. I personally have had the most experience with Nutrafol and Viviscal, and I feel like they're both kind of neck and neck for me. I have a lot of experience taking them personally as well as recommending them to patients. And as I mentioned earlier, I always recommend consulting your dermatologist first before starting a hair growth supplement to really help pinpoint the root cause of your concerns, just so you're not wasting money and so that you're just like on the best course of treatment from the get-go instead of experimenting. I hope you found this video on hair growth supplements to be helpful. If you enjoyed this video and you want to learn more about skincare, hair care, be sure to download my free gift, my top 5 skincare favorites. And remember to hit that like button, share this video with your friends, your family, and subscribe to my channel to start your holistic wellness journey for your mind, body, and skin. Thanks for watching.